Hi everybody. We're going to do renal disease, an organ transplant. This is chapter 54 in your 5th edition and chapter 49 in the 4th edition. And we've got about 34 slides, so I'm going to probably divide this into 2 videos. These are the objectives. Solid organ transplant is a surgical procedure in which a viable functioning organ such as a heart, liver, pancreas, lung, intestine, bone marrow, or kidney is placed into a patient ailing from end-stage organ disease. And the patient is called the recipient of the organ. Transplants are a lot more common nowadays due to all the advances in medicine, and by far kidney is the most common organ that's transplanted. There's variation in patient care and hospital recommendations, so it's best to not, that you can't really kind of cookie cutter this procedure. Everybody's circumstances are different, and different hospitals and doctors will have different recommendations and protocols. Major medical advances in organ transplantation have occurred because of effective immunosuppressant drugs such as cyclosporin, tacrolimus steroids, azathioprine, and mycophenolate. I think that might be spelled wrong, and sirolimus. So all of these drugs have made the ability for the body to take on an organ, a donated organ, so much more successfully. Although acute organ rejection is a relatively rare occurrence in today's world of advanced medicine, sepsis and chronic rejection continue to threaten the medical stability and the organ transplant recipient. So, let's see, clinical advances, greater number of organ donors, changing reimbursement structures, complex administrative models. So there's lots that goes into this, and there is a lot of kind of spinning plates and a lot to organize. Way more than just one doctor involved and different, organizations. So the United Network for Organ Sharing and strict government regulations have led to improved healthcare outcomes for individuals receiving organ transplantation. So it's a pretty well-run system, because you have to get, there's lots of people who get on the list, and there's a wait list, and making sure that the appropriate protocols happen and the appropriate steps happen between someone who's in need of an organ and then when they actually receive the organ. The United Network of Organ Sharing is a nonprofit scientific and educational organization that maintains the nation's only organ procurement and transplantation network. You have to really regulate this, because there's horrible stories of organs being sold on the black market, and harvesting organs of people who, wouldn't have died otherwise. And so it has to be very strictly regulated. The average renal patient waiting for a deceased donor kidney usually waits at least 2 years before receiving a transplant. The National Institute of Health, NIH, National Institute of Dental and Craniofacial Research provide the dental team with practical treatment guidelines for managing a patient's oral health before and after organ and stem cell transplantation. So to kind of summarize managing oral health before transplantation. So when a patient is on a wait list, we want to consult with the patient's transplant team regarding the patient's overall medical status to establish whether the patient is able to tolerate dental or dental hygiene treatment. Then we want to postpone any dental or dental hygiene treatment that's really not necessary, is maybe just more cosmetic or something that's just not important. We want to consider the need for antibiotic prophylaxis to prevent systemic infection from invasive dental and dental hygiene treatment. We want to consider the need to assess the patient's bleeding potential with appropriate laboratory tests. Pre-transplant patients may be taking multiple medications such as anticoagulants, beta blockers, calcium channel blockers, diuretics, and others. We want to address side effects of those medications, and then we want to emphasize the importance of oral health and proper oral self-care to minimize bacteremia and to prevent oral and dental problems after transplantation. Then the management of oral health after the transplant. The patient who receives an organ or stem cell transplant should avoid dental treatment for up to 6 months, except for emergency basis. We want to obtain medical clearance. We want to determine the patient's medical stability and ascertain whether the patient can tolerate treatment. We want to consult with the patient's physician to discuss medication considerations. We want to educate the patient about necessary professional oral care. We want to provide regular screening for oral and head and neck cancer because an organ transplant patient has an increased incidence of squamous and basal cell carcinoma. We want to consult with the patient's physician to discuss the appropriate selection, dosage, and administration of prescribed medications and drugs, and to ensure the safety of prescribed and over-the-counter medications. Common immunosuppressant therapy include cyclosporin, prednisone, and mycophenolate, mofetil. Risks include nephrotoxicity, long-term complications of bone metabolism, adrenal crisis because of being on steroids, and then nephrotoxic. There's a wide variety of over-the-counter and prescription drugs, along with herbs, common herbs that can endanger a patient who has a delicate balance of immunosuppression. They can things that would normally be totally fine for the average person could be nephrotoxic to somebody who is immunocompromised and who already has just a heavy burden of medication and an inability to filtrate out the things. They would overcome very easily, and something that might be totally fine over the counter, like over the counter Tylenol or something, could easily become toxic to them because of their delicate state. So we always want to consult with the medical team about anything that we would recommend for over the counter or something that they may be taking that slipped through the awareness of their medical team. Medication side effects. So immunosuppressive drugs can potentially cause gingival hyperplasia, poor and slow healing, drug-induced liver disease, that's that nephrotoxicity, and interact with commonly prescribed medications. Immunosuppression may result in an increased risk for bacterial, viral, or fungal infections, so especially candida. They're much more at risk for candidal infections. Anticoagulant medications may contribute to excessive bleeding problems. We have to assess the patient's bleeding potential with appropriate laboratory tests and consider use of hemostatic agents, precautions to limit the bleeding. Patients taking steroids are at risk for acute adrenal crisis, which is a life-threatening condition associated with high-dose or long-term steroids. So we have to take that into consideration, find out, how long they've been taking a steroid, if they take it every day, and then consider the stress that they're going to be under doing this dental procedure. Is it going to affect them? Are they really stressed? Are they scared? Is it going to be very painful? Those sort of things. Kidney transplants. A kidney transplant is by far the largest population of organ recipients. Dialysis is considered the bridge to transplantation. So oftentimes patients will be dialysis patients for a while before they get a transplant. And I think this might be repeated later, but dialysis cleans and filters the waste and toxins from the blood. It removes salts and extra water. It maintains a safe balance of certain chemicals in the blood, so it kind of balances the blood's chemical composition and pH. Helps control blood pressure. Deceased or live donor, so somebody could have died just recently and donated their organs, Or with a kidney, you could get a live donation from a family friend or off of the donor list, I suppose. Deceased kidneys have a 48-hour window, which is much greater prevalence than other organs. So an individual dies, they've put themselves as an organ donor, they could have died up to 48 hours prior before their kidney enters your body. So back to the gingival, just to reiterate, the gingival enlargement, it is a side effect of immunosuppressive therapy. Poor oral hygiene and increased sensitivity to cyclosporin will increase the gingival enlargement. It's associated with the medication tacrolimus. I think that's how you pronounce it. Transplant physicians are reluctant to change medication just for gingival enlargement, so it's our role to teach the patient to be very meticulous with their oral hygiene, to come in for frequent debridements, barring all those other things that we talked about, discussing with the physician if they can handle it, if they're medically stable, that sort of thing. Be aware that immunosuppressive therapy can mask inflammation, so they may not bleed as much, they may not be as puffy and red due to the immunosuppressive therapy. Gingival enlargement is also known as gingival overgrowth. It's another adverse side effect of immunosuppressant therapy, which I've said 3 times now. Gingival enlargement may occur due to the sensitivity to cyclosporin and may be exaggerated by poor oral health, which we said already. Cyclosporin increases risk of nephrotoxicity, which can be damaging to the kidneys, cells caused by a toxic agents such as the drugs. So we talked about that earlier. So over-the-counter drugs and things like that. So the immunosuppression will increase their likelihood to get a toxic reaction to something that normally wouldn't have been a problem. Most transplant recipients are treated with a trio of immunosuppression medications, which is the cyclosporin, the prednisone, and the mycophenolate, Mofetil. The dental team always must consult the medical team to ensure the safety of over-the-counter prescribed or over-the-counter medications. Dental hygienists always must be aware that immunosuppressive therapy can mask inflammation. I'm just really into repeating myself in this PowerPoint, unfortunately. Infection. Any infection can be reactivated or exacerbated in the immediate post-operative period during the introduction of immunosuppressive therapy and afterwards. So that's important to be aware of. The dental hygienist should educate the patients about potential risk dental infections play in organ rejection and infection. So if they're in this very delicate balance and all of a sudden they have a huge perio abscess, that can absolutely play a role and affect their organ if their organ gets rejected or if they get some kind of a big systemic infection. Premedication, so pre-med or no pre-med, it's a little controversial, it's talked about a lot. The bottom line is it really is up to that patient's medical team. So majority of medical providers recommend antibiotic prophylaxis for invasive dental treatment. Individually, you want to evaluate each transplant patient and of course consult with their physicians. Considerations include if or when to receive dental treatment, any comorbidities that are present along with the fact that they're having an organ transplant. Are they medically stable? Patient's medical management pre and post transplant, and then their pharmacological history. So you wouldn't make any decisions until you consulted all of these things with a physician. So other considerations, we talked about candidiasis and recurrent herpetic infections are common. This is due to the immunosuppression. Increased chance of squamous and basal cell carcinoma. This is an important one to remember, that transplant patients have an increase in those two things. Liver transplant patients with a history of tobacco use and alcoholism are at a particularly high risk for oropharyngeal cancer. And then immediately after transplant, only emergency dental care is recommended until you're at least 6 months post-transplant. I think I'm going to stop there and we'll do the second half because we're at about 15 minutes.